Okay, so as always, finding comfortable positions, sitting, whichever way feels good, that you will maintain for the hour. Feeling the sit bones touching the ground, the cushion. Relaxing the legs and letting the knees fall below the hips. And then finding the verticality. So shifting the spine left to right in order to find the balance point right in the middle between the left and the right. And then once you find the center point between left and right, shifting the spine forward and back, coming out of the verticality. And then finding the middle point at the center between front and back. And sitting up with a straight spine, reaching the sternum up towards the chin, tucking the chin slightly and pushing the back of the skull to the back of the room, and pulling the top of the head for the ceiling. Then coming to Ujjayi breathing, constricting the back of the throat, constricting the larynx, coming to that ocean breath. And resting in the sound of your own breathing. As the breath is coming in, gently paying attention to the breath coming in. And as the breath leaves the body, gently paying attention to the breath leaving the body. Maintaining awareness on the breath through the rest of the breathing cycles. And just resting the awareness for now in the throat, allowing the throat friction to wake up the throat chakra. And starting to bring the attention towards the third eye center, the space between the eyebrows. Maintaining attention in both the throat and the space between the eyebrows. Just linking the two and maintaining this dual attention. And when you bring the awareness to the space between the eyebrows, and just paying attention to any sense of vibration, any subtle sensations on the skin that may appear. And breathing primarily deep into the abdomen rather than a superficial breathing through the nose into the upper chest. So as you maintain the awareness on the throat and between the eyebrows, drawing the breath through the constricted throat all the way down into the bottom of the belly, allowing the breath to travel that far down. And then while maintaining the Ujjayi breath, bringing the attention to the third eye space and paying attention to any indications of light or color or shapes, anything that may come into the third eye space visually. And then shifting the awareness from any color, shapes, or light in the third eye to the darkness, the pervasive background that is behind the colors and shapes and lights, behind the closed eyes. Just paying attention to the quality of its darkness, maybe the quality of the color blue or dark purple. And just sitting with that and resting in awareness with that background. And at the same time maintaining still the throat friction breathing, the psychic breathing, Ujjayi breath in the throat. And again linking the two, the throat friction and whatever you observe in the third eye. And then withdrawing the attention from the pervasive background darkness in the third eye space and placing the attention on any sense of movement in the third eye. Maybe a vortex that's in front of you or behind you. Any sense of buzzing or vibrating in the body. Maybe rocking forward and back. Again, not trying to make anything happen, but just following with the attention what might already be there. And maintaining slight throat friction breathing at the same time still. And then gently shifting the attention from any sense of movement in the body or in the third eye. Just bringing the attention back to any physical sensations in between the eyebrows. Maybe buzzing, maybe slight tingling. Maybe you feel the skin between the eyebrows. And then releasing the attention from the third eye and letting the attention drip all the way down into the throat. And then releasing the Ujjayi breathing altogether and coming back to normal breathing. And still maintaining the awareness on the inhales coming in and the exhales leaving the body. We'll shift into the practice of Jalandhara bandha, which is the throat lock. So if you're sitting cross-legged still, you can place the palms on top of the knees. And then keeping the eyes closed, relaxing the entire body for a moment, relaxing the face, relaxing the cheeks, the lower jaw, relaxing the throat. And then inhaling deeply into the belly, all the way into the belly. Then we're going to hold the breath, retain the breath inside. Then you're going to bend the head forward at the neck and tuck the chin towards the chest. And then straightening the arms and locking the arms in position. And holding the breath. Then hunching the shoulders upward and forward. Keep the arms locked. Keep the palms on the knees. And then bending the arms, relaxing the shoulders, releasing the chin. Raising the chin and then inhaling, filling up the lungs and coming back to normal breathing. Then we'll do this Jalandhara bandha a few more times. So palms on the knees, slight bend in the elbow. Relaxing the shoulders down, relaxing the face, the throat. Then inhaling, filling up the lungs, filling up the belly. Tucking the chin under towards the chest. Extending the arms straight, locking the chin. Hold the breath here. Just holding for as long as possible, and when you're ready to release, bending at the elbows, relaxing the shoulders down, lifting the chin, and then inhaling. Then getting ready for the next round. So palms on the knees. Inhaling all the way into the lungs, into the belly. Tuck the chin under. Arms straight. Holding the breath here. Holding the chin lock. Keeping the breath in. Then whenever you're ready, releasing the elbows, lifting the chin, inhaling, coming back to normal breathing. Then we'll do this Jalandhara bandha one last time. So palms to the knees, slight bend at the elbow. Inhaling, tucking the chin. Straighten out the arms. Chin towards the chest, holding the breath. Holding the chin lock. Rounding the shoulders up and forward. And then whenever you're ready, bending at the elbows, dropping the shoulders, lifting the chin, inhaling. Coming back to normal breathing. Just observing the effects of the practice on the body, on the throat. Just staying attentive to any changes. Any sensations. And then preparing for the second practice, Kechari mudra, which is the tongue lock. So keeping the mouth closed and still breathing through the nose, maintaining normal breathing. Going to bring the tip of the tongue all the way to the back of the throat, so sliding it up the upper palate, and as though you're trying to touch the back of the throat with the tip of the tongue. And then keeping the tongue there for as long as possible and maintaining the breathing. Keep pulling the tongue closer to the back of the throat. Trying to reach with the tip of the tongue to the back of the throat, but doing this without any exuberance, strain. And then when you're ready, releasing the tongue into its normal position and just resting. Coming back to normal breath, following the breath coming in and out with the attention. And then we'll do the Kechari mudra 2 more times. So again, relaxing the face, relaxing the throat, then sending the tip of the tongue to the back of the throat as far as possible. And keeping it there, maintaining normal breathing. And still following the breath in and out with attention, while keeping the tip of the tongue reaching for the back of the throat. And then whenever you're ready, releasing the tongue to its normal position, coming back to normal breathing and resting, allowing the benefits of the practice to be absorbed into the body. Then getting ready to perform Kechari mudra one more time, the tongue lock. Relaxing the face, the throat, the shoulders. And sending the tip of the tongue to the back of the throat. Maintaining normal breathing. And the advanced option is to introduce the Ujjayi breath as you maintain the Kechari mudra with the tongue. So that's an option. And we'll perform the Kechari mudra for a few minutes. And then releasing the Kechari mudra wherever, letting the tongue rest wherever it's comfortable. And then just staying with the Ujjayi breathing, the slight throat constriction. Just staying in a restful position, maintaining slight awareness in the throat through Ujjayi breath. And just resting in the awareness of the throat, the Vishuddhi chakra. And imagining a bright blue lotus flower opening through the throat chakra. as you're imagining the lotus flower opening up in a bright blue color, bringing to mind the following affirmations that all resonate with the development of this chakra in the throat. I hear and speak the truth. I express myself with clear intent. Creativity flows in and through me. My voice is necessary and important. Just allowing these statements resonate in the body. I hear and speak the truth. I express myself with clear intent. Creativity flows in and through me. My voice is necessary and important. So self-expression and creativity are two important things for the throat, and the issue that might stop the development of the throat chakra or make it imbalanced is not being honest, lies that we hear from others, but also untruths that we tell ourselves. So creative expression and communication skills and symbolic thinking are all things that will develop the throat chakra. And the basic rights that are associated with this area is the right to speak and the right to be heard. And so activities that will balance this throat chakra in life is developing a resonant voice, a voice that is true to who you are. Being a good listener. And having a good sense of timing and rhythm for speaking, but also for life. Another one is developing clear communication, so not withholding information, not oversharing, being proactive and communicating. And then finally, creative life. Creative life will also balance this chakra. So allowing for creativity to freely flow in and as well expressing it through the body, through the voice, through the hands. through art. So the developmental stage for the throat chakra in children is usually between the ages of 7 and 12. And so the traumas and abuses that will hinder its development are lies and dishonesty, and also mixed messages from others, from our caregivers, from those who are part of our early development stages between the ages of 7 and 12. Verbal abuse and yelling will hinder the development in the throat. Excessive criticism from caregivers, which eventually blocks the creative flow in children. And then any secrets, so secrets are withholding truth. And then any threats for telling the secrets. Authoritarian parents usually stifle this development as well, because it primarily discourages talking back, quote unquote. So it discourages your own voice, discourages your own truth to be expressed. And then anything in the family that is to do with excessive addictions, because these kinds of dynamics prevent the children from speaking their truth. It's tough to develop trust, and it's tough to develop a sense of feeling in your own body. So some of the deficiencies in the throat when the chakra is unbalanced are fear of speaking, or having a small, weak voice that doesn't fit the body that you're in. Difficulty putting feelings into words. Introversion and shyness can be a sign of a deficiency in the throat chakra, lack of trust in yourself. And then sometimes being tone deaf or having poor rhythm can also be a sign of deficiency in the Vishuddha chakra. And then of course, you can have a deficiency, but also you can have an overly active throat chakra, an excess. So this will be usually seen in too much speaking, talking as a defense mechanism, talking as a way to fill the silence and avoid discomfort of a silence. Inability to listen, so not letting others finish their sentences, and then gossiping or having a dominating voice and interrupting others is usually also a sign of an excess in the throat chakra. So staying still with the attention, the natural breath coming in and out through the nostrils. And maybe, if it feels right, coming back to Ujjayi breath one last time. Hearing your own breathing. So some of the healing practices for the throat space. Anything that will loosen the neck and the shoulders, so getting rid of the tension in the neck and the shoulders, and releasing your own true voice. Anything to do with singing or chanting or vocal toning, storytelling can help develop the throat as you connect to your own truth through your own story and sharing that story. Writing in the journal, or just free flow, automatic writing, where you just let whatever's inside of you come out through writing, just a stream of consciousness, kind of journaling. And practicing silence for long periods of time can be very healing for the throat chakra. And then practicing any type of creativity, but most importantly, any non-goal oriented creativity. So just being creative for creativity's sake without a goal in mind. And then finally, therapy can also be a great help, because you can learn effective communication skills, communicating completely, and then also communicating through to the inner child, so speaking directly to your own inner child experience. So preparing to close the practice, bringing all the attention into the throat one more time, and seeing that bright blue lotus open up And maybe feeling the warmth of the vibration in the throat. Maybe any other kind of sensation. And allowing that to drop from the throat into the heart. And just staying with that for a few moments. Now as you inhale, feel the inhale in the throat. And as you exhale, feel the exhale coming through the heart space, out of the body. Inhaling through the throat, exhaling out of the heart. Inhaling through the throat, exhaling out of the heart. Just connecting to the heart chakra. Inhaling through the throat and exhaling out of the heart, connecting the two spaces so that the creativity that comes through is connected through the heart. The communication that comes through is also coming from the space of the heart, from kindness and love and respect. Inhaling through the throat, exhaling out of the heart. And then to close the practice, if it feels good for you, bringing the palms together in front of the heart. Or maybe plugging the thumbs into the heart. And then bringing the index finger towards the space between the eyebrows, bringing the head down. So in this position, remembering that the head is in service to the heart. And then releasing whenever you're ready. Softening through the body. Softening through the shoulders, softening the face. And then whenever you're ready, gently, slowly opening the eyes, coming back to the room. Thank you.